Go ahead, my dear, go ahead.
Okay, you're gonna keep that up all the time? Oh, I think the health fair is extremely important in terms of bringing awareness, increasing awareness within the population about the importance of the prevention and management of non-communicable diseases. Certainly we are all well aware that these are our leading causes of death and disability, also from the complications. So it is timely and it is important for us to be doing these activities ongoing.
Okay, the Zero Hunger Challenge is playing a major part in this activity today. Tell us about it and the importance of this program.
October 16th is World Food Day, and we were invited to participate in the health fair, and we've thought that on the eve of World Food Day that it would be a good opportunity for us to showcase the backyard gardening project in particular that has been implemented under the Zero Hunger Challenge initiative. Because when we promote healthy eating, we also have to think of access to healthy foods. And certainly one of the ways that you can increase access to healthy foods at the level of the household is by encouraging persons to grow some of the foods that they eat. We know that one of the complaints we get from individuals who don't eat fruits and vegetables on a regular basis is that these items are costly. So the Zero Hunger Initiative, one of the approaches we use is to show people how they can grow, even within a very small space, some of the foods that they eat. We are also focusing today on seasonings that are salt-free, seasonings that you can grow in your house. So we have things like chive and thyme and parsley and celery and basil, and some that may not be so familiar, like rosemary. You can grow them in little plastic containers, and to get away from using the seasonings that are high in salt and sodium. So people, of course, want to enjoy the taste of their food. So we are using this to promote flavor enhancers while you are reducing your dietary salt and sodium intake.
How are you getting the public involvement in this backyard garden initiative? How are you getting them on board?
Well, we have certainly been to the media, we have been in community, we have been working with partners such as the Guard Center, church groups, etc. We also have had officers over the past 2 years and more going into community, mobilizing persons seeking the interest. And we have had so far over 500 persons registered on our backyard gardening program. There has been some fall off in maintaining gardens during the period of drought, but certainly now that the rain has started a bit more, we have been receiving again more calls for people to set up their gardens.
Do you still see a problem with this taste, this salty issue if your food don't have any salt, that's it? Tell us about the hidden salts in food and so I think you need to consider.
Let's be frank about it. Culturally, we have a lot of foods that are high in salt and sodium. We have our seasoned rice, we have our pepper pot, which the majority of people will prepare with pickled meats. And that's, a challenge that we face. We also have on the market a lot of salty snacks, which are fed to children, in the home setting, in the community, in the school setting. And that is a huge challenge. How are we going to address that? We're currently working on a project to work with mothers, work with other stakeholders as to how they can reduce the dietary salt intake. I don't think it is an impossible task, but I think we have to build the awareness, get the support of the various partners that this is important. We don't want our children developing a taste for salty foods early in life, which will of course make it a lot harder for them to appreciate foods that are not high in salt, because if they grow up eating those foods, it just becomes a norm. So we are certainly working at that level to build the awareness, but also to create the kind of environment that will make it easier for individuals to make the healthier choice. A lot of the mothers we have spoken to, when you ask what would be the alternative snacks that they feel could be given to the children, they speak of fruits in particular. They speak of like crackers or sandwiches, items that are not high in sodium or high in salt, but they also still complain that these are more expensive and not as easily accessible to especially persons who are vulnerable.
The Ministry of Health and other health organizations have been pushing health fairs, lectures, and yet we still hear about the high cost of medication. It is rising with hypertension, diabetes. What is it that it is not, why is it not reaching the public as much as we would like to?
We need to ask the public a little bit more. In our surveys, we have seen in Antigua and Barbuda a rapid increase in health fairs. And you see many of the same persons participate over and over again. And we have been discussing very recently that we need to go back to those persons and conduct a survey and say, have you, ask questions like, you have participated in these health fairs. How has it made a difference in how you live your life? Has it made a difference in the management of the conditions that you might have been diagnosed with? And if not, what are the challenges that you face? How do you feel you can get? What kind of support do you need, to do better?
Well, the MBS gave me a similar answer. The follow-up aspect, he says, is a bit lacking, and the following through on what you've discovered or what you've shared initially. So it's a similar point you're making.
If I put on a different hat, I work also with the Diabetes Association, and certainly we have been involved in many screenings and education in community, in workplaces, in schools. And one of the principles we adopted very early is that if persons turn up with abnormal results from the screening, that cannot diagnose them with a condition. So we generally call back within a 2-week period, to find out whether the advice, the counseling that had been done on site at the screening, whether people have been able to act upon recommendations, and to encourage, persons to see their healthcare provider, visit the clinics regularly, take medication if they are on medication, all the other things, exercise, the way they prepare their food, what they're eating, all the other risk factors. I really do think that a more supportive environment as well will help persons to adopt some of these same changes in lifestyle that have been recommended. And I do also feel that it has to be a whole of society approach. It cannot be the Ministry of Health or the Diabetes Association or medical benefits or the Rotary or whatever, Lions or whoever is doing the health fair. But it has to be all of us working together towards a common goal.
How close are you working with the primary school or even younger in particular to promote this whole healthy lifestyle initiative?
Well, there are 2 ways that we work in the primary schools. Under the Zero Hunger Challenge initiative, we are setting up school gardens. And again, this is a way of getting the children interested in food production. They get an appreciation for how food is produced, and once they have participated in the production of food, to encourage them to eat some of those same foods, mainly vegetables, but we're also planting fruit trees. And there is education through the Health and Family Life Education Program. Also on special days of the year, so you have World Health Day, you have World Food Day, World Diabetes Day, etc., that we also go into the schools and we do health promotion, health education. Again, I think that it can be better sustained, that you don't just carry out these activities on a particular day, but we have a better integration of these programs into the school curriculum and into the school programs.
2 more questions. The Zero Hunger Challenge, how long is that in a nutshell, basically, in terms of the Antigua leg?
Well, the project started here in 2013, and it initially was a 2-year project. It has been extended and will go into 2016. However, activities carried out under the Zero Hunger Challenge initiative have been carried out in the context of our National Food and Nutrition Security Policy, and certainly through the Ministry of Agriculture and other ministries, Ministry of Health, Ministry of Social Transformation, Ministry of Education, so that these activities, these programs, we are working as well to see how best they can be sustained beyond the Zero Hunger Challenge Initiative funding.
Which lasts how long?
Which goes on till the middle of 2016.
One more thing, the FAO, in conjunction with how tell us of other initiatives that is under the FAO banner that you have been working with.
Well, even before the Zero Hunger Challenge initiative, the Ministry of Agriculture has been the focal ministry in Antigua and Barbuda. Gets technical and financial support in some cases from the Food and Agriculture Organization to implement its program of work. So the country identifies what are its priorities, what type of support it would need from FAO, and right now we are approaching the end of what is referred to as a country programming framework, which is a 4-year period. And the new country programming framework is being developed with consultation from the various stakeholders, government ministries as well as NGOs, private sector, for the upcoming next 4 years. And those programs that I had identified by the country as priority, and they will be implemented with support from the FAO.
Excellent, Ms. James.